All right. Good afternoon, everyone. We'll call this June 17th, 2025 Jefferson County Board of Health meeting to order. Lindsay, will you help us with the roll call, please?
Sure. Sarah Lindsay. Present. Rochelle Wood.
Present.
Harriet Hall.
Present. Present.
Carrie John.
Here.
Lane Draper.
Present.
The record of form has been established.
Great. We really just have one business item, that's the consent agenda, before we turn it over to Jim. So if someone would make a motion to approve the consent agenda.
I did not see anything that needed to come off. I will
It's just
make a motion to approve.
two contracts.
Yep.
Second.
Any additional discussion before we vote? All those in favor, please say aye.
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 Right. Contracts approved. Consent agenda done. EH services update.
Well, good afternoon. I feel like I'm sitting in my living room talking to my old friends from way back. Hello, Rochelle. Hello, Harriet. Good to see you all. As you know, this is, well, you may not know, but this is probably the hardest assignment I've had in the last 13 years that I've been to in Jefferson County. Mainly because I've never been asked to give an update or a briefing or an overview of our programs to the Board of Health in the past. So what I'd like to do, since we are a small crowd today, and looks like we're pretty small online too, is to make this somewhat of a conversation. I would like to share details about our programs. I've kind of arranged the presentation in the format of our basic cost centers that we use for budgeting purposes, but kind of walk through some of the details of the program. It being a conversation, if I'm getting too deep in the weeds, tell me, we're all friends here. If I'm not getting enough, I'd love to just have you ask, interrupt me and ask questions so that I can make sure that we're providing you the information you want to know about what environmental health does, where it is. Lindsay, if you go to the next slide, please.
Or I haven't even.
She hasn't even pulled it up yet.
So sorry.
I've set a couple of targets for the session today. And the first one is really to provide you with any new knowledge or refresh any knowledge you had about environmental health programs here at Jefferson County. Kind of where we all fit in the grand scheme of environmental health in Colorado, both locally and at the state level. Touch on what the board's roles are for various aspects of some of our programs, as well as where the board might engage in the work of environmental health, either from a communications or community engagement or regulatory or advocacy role. But again, I'd love to have this be a constructive conversation so that I'm providing you with whatever information. Next slide, please. So I want to start by kind of bragging on my staff a little bit. It's an amazing organization as a whole. JCPH has been through a ton in the last few years, but I'm really, really proud of my team. COVID really did take a toll on the environmental health unit. I think I only have about 5 out of my 18 environmental health specialists that have been there longer than 5 years. So, and some of the positions that we've hired in the last 5 years have turned over again. So we've had a tremendous amount of staff turnover in the last 5 years, and we've had actually some administrative support staff turnover too. And when we have such a complex program or set of programs, there's a lot of administrative details, whether it be data entry or billing or anything that our administrative support staff does that it takes a while to learn. And we have a somewhat unique database here in Jefferson County. We share what's called the Amanda database with our partners in planning and zoning, building, transportation, engineering. It was a system that was built for permitting, but we've also built our inspection program pretty much from the ground up in that over the last 20+ years. So just the administrative side of Amanda really is complicated. And so we've got 2 full-time administrative support staff that they keep our ship floating. And then just last year, we were able to convert one of our staff to a business support supervisor position. Terry O'Connell, you may know, she oversees all of the administrative functions, but she's an environmental health specialist by profession. So she really knows our programs in and out, but then also has a real keen sense of the administrative detail that goes into our programs. So a real huge shout out, kudos to our staff for the resilience and all the work that they've been doing to train new people. Training is takes an enormous toll on the seasoned staff. And as we've gotten people trained, we're able to use those new staff as trainers too. So hopefully share some of that burden. We've also been fortunate to bring on a number of staff who have experience in environmental health. So that's been very helpful too. Unfortunately, after COVID, there was a lot of moving around in public health. And so we were able to get a few people from other agencies. The formerly known as Tri-County contributed to a couple of our staff vacancies. A couple other details that I wanted to share is we have 4 supervisors and 8 environmental health specialists that hold master's degrees. I think we really have brought on a talented group, a well-educated group in environmental health. Many of our NPHs are in epidemiology. And that really adds to our capability to do certain things, some things you'll hear about in a little bit. 13 of our staff, our environmental health specialists have National Environmental Health Association credentials as registered environmental health specialists. So 13 out of the 23 or so in professional environmental health specialists have that. And we're encouraging all of our team to continue to learn and then work towards achieving those credentials. But in addition to that, we also have several other credentials represented on the team through the certified professional food safety. We have certified pool operators. We have specialists who are certified by the National Association of Waste Transporters in on-site wastewater design, on-site wastewater inspection. So we really encourage ongoing continuous learning and updating of skills.
Can you give I've always been curious about your requirements. So NEHS, is there like a requirement across the field that is known? Like you have an NEHS, then you can become a supervisor or director. Or is there some sort of pathway that an NEHS opens up to people, or is it a departmental priority that you say we'd like to have people certified under this?
You're referring to the REHS.
REHS, sorry, not REHS. Thank you.
The REHS is recognized nationally as
Yeah.
a credential for environmental health professionals. Many states have credentialing requirements that utilize either the REHS or they may even have their own state credentialing program. There is no such program in Colorado, not that I'm aware of. And but many agencies have set the credentials as qualification or minimum qualifications for higher level positions. We do require for our senior environmental health specialists and above that they get that.
Okay. And there's a pathway for them to then be able to get that if they don't have it already, to ensure, like, if they're up for promotion, Greg will help you.
Well, that's been a question through HR, whether we can say we can promote you if you will go after it. We really want to push, if that's a good word, to folks that are in the junior positions to achieve that so that they can move into a higher role. I am working on some reclassification of positions to create more of that job ladder, which might be able to allow us to take, I think the National Environmental Health Association now has a credential as a REHS in training. So
Oh, okay.
someone with less experience can get that credential, and then when they hit the experience level, they automatically get the full credential. So, but it's really an important element, I think in our overall staff training, it really does, in my mind, emphasize the need for, well, if someone's willing to go that route, they've made a career choice. Did you have a question, Chair?
Sorry, I'm just, I'm just used to going through the change.
That's okay.
So if someone is like really, into the program, wanting to do more, wanting to complete moving up, as Sarah said, do they have to pay for the additional training themselves, or is there a program within Jefferson County's public health?
I'm glad you asked that question because that for the 13 years that I've been with the county, I have maintained a budget every year to be able to pay for the exam and then any ongoing CEUs to continue re-credentialing folks so that they don't lose that. My promise to them is I will continue to do that as long as I have a budget to do so. And we've been very fortunate over the last 13 years to be able to continue to keep that as part of our total rewards approach.
Oh, I think it really entices people to, look down the road.
Just to cover a couple other points, we also work on other workforce development activities, trying to connect with some of our academic partners around the state. We offer many internships. In fact, right now we have 2 interns they're both students at the School of Public Health, but they're also working through this summer through the Rockies and High Plains Vector-Borne Disease Center in Fort Collins, and they're supporting our mosquito surveillance program this year, and that really reduces our costs. And then we have a couple of our environmental health specialists who are bilingual certified through our bilingual compensation program. So that affords us the opportunity to really do a lot more with some of our business communities and our regulated facilities and helping them when we have English language proficiency issues. Next.
Are they bilingual, Spanish, English, or do you have alternate language?
Spanish, English. One of them is also, I don't know if she's certified in it, but she speaks Polish fluently too. So we do have that opportunity. But the Spanish, English, we've really taken advantage. That's a bad term. We really have utilized those skills in those people, particularly in our health education and outreach opportunities regarding our food program. And we'll talk a little bit more about those things later on in the presentation.
Can I add something?
Yes.
We also have somebody that is ASL, that's awesome as well.
That's awesome.
Thank you. And by the way, I'm going to invite my staff and anyone else on the screen to participate if there are questions out there. If anyone on screen asks questions, if you would ask the chair to acknowledge you, that'd be great. Next thing I wanted to just briefly touch on is the 2025 budget. Just give you some really rough numbers on what our division costs the community and where we get our revenue from. So our annual expenditures for 2025 were projected to be $3.4 million. Our anticipated revenue is about, our fee and grant revenue is about $1.5 million, 300,000 of which is grants, and the remainder is in fees for licensing, plan reviews, permits, contractor fees, various inspections that we do, resulting in about $1.9 million coming from the county transfer. So we are supported heavily by the county, and there's not a whole lot more opportunity at this point for us to get more revenue. Especially since we don't have, someone who can really spend a lot of time seeking grant funding, so. Next.
Do you have, sorry, real quick question, do you have, an estimate for, I mean, I know the bill just passed the state legislature to increase retail food licensing fees gradually over the next 3 years. Do you have an estimate of how much more that would be? I know that's not this year's budget for next year.
Some of it will begin this year.
Okay.
The license fees will take effect September 1st, so we'll
Okay.
see a bit of a bump from what we had originally projected, but I'm estimating that we'll see somewhere in the order of about 700,000 increased revenue, license fee revenue, over the next 3 years. So that'll be quite.
That's helpful. I mean, it's enough year over year.
If we can keep the money that we currently have and that 700,000, that would be a very big opportunity for us to perhaps improve our staffing purposes.
That's great.
Jim, for the other fees that are set in statute, how close to full cost recovery are set right now?
That's a challenging question, as you know. I think what we do is we estimate the activities and the amount of time that we spend in those programs per establishment. And then we apply our hourly rate to that. So I don't really know. I'd have to look a little deeper at the accounting reports, but I would suspect we don't come close to 100% cost recovery. But on the other side of that coin is what's a reasonable price for the services that we provide to the operators that we regulate. So a childcare facility, if we, right now, I think we're charging them over $200 for an inspection. Or around $200 for an inspection. That can be a hit on some of the operators that we work. Swimming pools, we have a hard enough time collecting those fees right now, let alone charging them more. We probably recoup less or have to spend a lot more time collecting fees. So we try to establish a reasonable fee level based on the amount of time that we spend. And those hourly rates do include our indirect costs or indirect rates. So we try to recover some of those. So next slide, please, Lindsay. Some of the program staff, these are just general principles that I've kind of established in my organization of the environmental health and the programs that we administer. Education and compliance assistance is really our focus. We really want our businesses and regulated facilities, contractors, et cetera, to be successful. We really want to help them succeed in what they're doing. Enforcement authority is driven by regulatory requirements, imminent health risks, or blatant and chronic non-compliance. We don't have a lot of that, but when we do have compliance issues, we utilize the tools that we have to make sure folks are getting into compliance. Our EH specialists generally have a strong science and or public health academic background, although we have hired former restaurant managers, we've hired psychologists, we've hired teachers. We really look when we are hiring at people who have skill sets that we believe will fit well with the team, but also serve the needs of the community. EH specialists initially are trained in 1 to 2 program areas. You'll hear in a minute about some of our programs, but we usually start people in the retail food programs, since that's where our biggest demand, biggest need is. However, we've started some people in on-site wastewater because of a gap in service needs. But we really try to get them focused in some of our bigger program areas, and then we encourage them to grow into more generalized environmental health field, or if we have specialized needs within certain programs, and individuals have those skill sets, we'll put them into those roles. And then we definitely encourage anyone now, we've begun this effort in our newest hiring to look for folks who have experience, life experience, and other elements of public health, like environmental justice, like sustainability, climate resilience, those types of fields, so that we're bringing people in that can help us to really integrate those principles into the day-to-day work that we do. Next. So, going into some of our programs, I'm going to kind of buzz through some of these details. If you have other questions, please ask. Currently, we have over 2,400 licensed retail food facilities active in Jefferson County. We utilize about 14.5 FTEs spread over about 23 of our staff. So this goes to that generalist point where we're spreading people over multiple programs. This includes program manager time, business support, admin support, staff time. That's about probably 2.5 FTE right there. The activities involved in retail food, plan review, construction plan review. We did 257 plan reviews last year, which is a pretty substantial number. We do construction inspections. There was 327 of those in 2024, as well as the licensing of all of the retail food facilities that we regulate. Last year we did 2,160 routine inspections. We did 170 mandatory re-inspections that are part of the enforcement process in that program. And then we do complaint investigations. I got a typo there, $9,000 so far in 2025. We collect civil penalties also on enforcement. This year we've collected around $9,000 in civil penalties, mostly related to late renewal license renewal fees.
Where's your typo?
Complaint investigations, 9,000 so far this year, $9,000.
Oh, 9,000.
I'll revise the slides before I say it.
I hope you haven't had 9,000 complaints, because that.
Well, sometimes it feels like.
There's a
We also have, we've done some work. We have a small team this year working on revising our approach to mobile retail food inspections. And we're actually inspecting them in the first 6 months at their commissaries. We've gotten some really good feedback from the commissary operators that it's really good to have the health department in there and making sure that folks are doing the right things in their facilities. This work is delegated under an ongoing annual CDPHE task order. So really the state has primacy over this program. They are the responsible group, but we enter into an annual MOU with them. They give us about $95,000 in grant funding, so to speak, along with the license fees and other fees that we collect. That task order is meant, the $95,000 is meant to support our retail food program, but also our child care and school and special programs. Those fees are, as you know, set in statute, and they cover generally about 50% of the cost of our program.
Jim, I have a question for you. Can you educate me to what cottage foods are and how that falls into this program, or is that not applicable to this program?
Yeah. I'll do my best. Lane can fill in some of the gaps on that one. Cottage foods are covered. Those are products that are manufactured in private home or in a private space. They're not regulated. Currently they're regulated, or the law that governs them is the same law that governs retail food establishments. The types of food are restricted to certain types. The amount of revenue they can earn is restricted to a certain amount, no more than a certain amount. Could be anything out there.
Yeah, the state kind of has more primacy over that. Basically, it's an exemption in the retail food rules that allows cottage food to be done, you know, and restricts where it can be sold. It can't be sold in retail food, grocery stores.
Right.
Typically farmers markets, direct from the producer to the consumer.
There are specific labeling requirements on them. They have to have certain levels of training. The operators of those businesses are required to get some sort of training, education, basic food safety educations.
And they're pretty limited on what they can.
Right now, it's non-temperature controlled for safety foods, so things like pastries, jellies, jams,
And it's
Right.
acidified, like salsa.
Every year, the legislature typically there's a push to
There's a tweak.
try to make it pretty, if not
Broad.
Food Freedom Act like what Wyoming has, which is everything.
We'll talk a little bit more about that in a few minutes because it's one of the emerging issues, and I think that the board might find themselves in an advocacy role for it in the future.
It's a big workload without any money and not a lot of oversight from the state.
Yeah.
True. Because you still have to verify kind of what's going on in the farmers markets to some degrees.
Anything else, Rochelle, Harriet?
Yeah, please interject because all we can see is Jim's presentation. So if you're raising your hand or doing anything chat wise, I won't see any of it.
So far, so good.
Great, thank you.
Thanks, Jim.
So I wanted to move on to the onsite wastewater treatment systems program. In 2024, we did 279 construction permits in Jeffco, 676 use permits. Those are the permits that are required for the transfer of title on a property. We generally run somewhere between, when the real estate market's good, we could do 1,000 of those a year. Things have slowed down a bit. So 676. We have about 5.5 FTE spread across 9 staff members in this program. That also includes administrative support and management, program management. In this program, we do permit reviews, field inspections, almost 900 last year. Complaint investigations, we had 90 complaints last year on anything from failing systems to failing components to who knows what else. And which has caused us to have to really review, refine our enforcement procedures to keep things moving smoothly. And we've had a lot of involvement of the attorney's office within the last year or so in that program.
So just for clarity, for each complaint investigation, is it per investigation or is it like 90 different homes?
90 different locations.
So there could be multiple in one location, but that's not counted multiple times.
Yeah, usually it's one complaint. And,
Or
I think that
yeah.
predominantly what we're looking at is either failed systems or failed use permit inspections that require some sort of repair be done in order to clear a home for sale.
And the field inspections are per location too.
There may be multiple inspections on a permit. Generally, there will be, say, 2 to 4 inspections on any given construction project, mainly depending on how they have to stage the project.
Okay, that's helpful.
We also spend a little bit of time on private wells. We don't have any regulatory authority, but there's such a direct connection between the water we're polluting and the water we're drinking, just to put it bluntly. The Mountain Groundwater Overlay District here, which is a designated area of Jefferson County that is designated by the county commissioners in the land use regulations. It's a very sensitive environment, and the aquifer is very limited. It's in fractured granite. We have 25,000 plus onsite wastewater systems in our mountain communities, probably most of which are in the Mountain Groundwater Overlay District. So we have a lot of concerns about what's going into the ground and making sure that our regulations are adequately addressing the potential risks of contaminating the groundwater supply. So, we've had over the last several years, I've been fortunate enough to budget a few $1,000s towards laboratory services, and we've offered limited amounts of well water testing, free well water testing. As long as the funding will last, we can offer it. And so we're trying to get people to pay more attention to the quality of their drinking water, determine what's in that water, and if need be, take steps to treat that water to make sure that it's always safe to drink. We intend to keep that going as long as we have a budget to do so. I don't put an exorbitant amount in the budget, it just enough to be able to hopefully encourage some people who might have concerns out there to test. And we're testing, we've been doing what's called the General Colorado Package, which tests for several heavy metals, E. coli, some minerals, nitrates, and so on. To give a general picture of the public health aspects that might be associated with one's well water.
Is there any radiation? Is that?
Uranium would be a separate charge, I believe. But there is plenty of, as you know, there is plenty of uranium in our foothills and in the Front Range. And we've had a number of hot wells. So we really do encourage people to, if they do the Colorado package, to add on the uranium so that they can at least know what's there. Uranium really does create a risk, long-term chronic health risk around things like kidney disease. So.
Any other like PFAS or anything that popped up?
I have not been pushing the PFAS issue so hard because the state really has taken the lead on that and they had funding to be able to support. We did add to our website information about the state's well water testing program, and then really push people towards that if they're interested in testing the water for PFAS.
Can you define PFAS, please?
These are what's known as forever chemicals. They're manufactured for a huge number of purposes in the industrial world. And they've been found in water supplies at just about everywhere. And we can all assume we have some level of PFAS in our bodies. So the federal government, along with the state of Colorado, have really taken a lot of action to try to address the sources and to reduce the sources, modify the materials that are being used in various industrial processes so that we're not using as much PFAS. And then doing whatever they can, working with both public wastewater and public water systems to treat their respective waters to the levels that EPA has established as reference levels for safe PFAS products.
What does it actually stand for though?
It's the technical name of the chemicals.
Polyfluorinated.
I was
Somebody Google that, would you?
I'm Googling it right now.
It was, we don't have a lot of manufacturing amounts, but it was used in firefighting
Yeah.
too, so that's
Yeah.
where I think it is contaminated some of our rural areas.
Yeah.
Mountains, especially like rural firefighting.
It really came to the forefront with, I think it was down in the Fountain area around the Colorado Springs area, primarily associated with Air Force bases, because they had a lot of practice with these PFAS foams.
How do you see a lot of the federal changes affecting all of this? Will you have the funding to continue doing
Our funding is not, we have a few sources of funding, smaller grants that are federal, either federal direct or federal pass-through. I don't see it as hurting us too well. In fact, you will hear in a minute about our Love on Air program, and that we've been hearing from EPA that that program's pretty solid through the end of our grant. Our radon grant is a federal pass-through from EPA through CDPHE. That money, we've already submitted our grant application for the next cycle. So right now, it looks okay for us, not as, it looks a lot better than some of our other programs at the health department. But yeah, we won't know until all of that starts. So.
Jim, I dropped what PFAS means in the chat. I would love to hear you pronounce that for all of us.
All right.
What is it?
Can't
I
see
can't
it.
see it.
It's just on per and polyfluoroalkyl substances.
Say it again, say it loud.
Oh my gosh.
We'll get it sent to everybody.
Per and polyfluoroalkyl substances. Thank
The,
you.
the big, the nastiness part of that chemical is the fluoro. The fluorine is a bond that doesn't break, so it doesn't fall apart. It doesn't degrade in the environment. So there's a lot of research ongoing right now to determine methods of breaking it down so that maybe we could actually do some good cleaning. Next slide, please. Swimming pools, very small program. I'm still on the side as well. We have about a third of an FTE spread out across 8 people. This is one we really, it's just kind of one of those programs where we want to use people's skill sets in water and chemistry and disease control, and it fills in a lot of our service gaps. So we have 8 staff working in there currently. We have about 100 plus public and semi-public swimming pools in Jeffco. Our activities include plan review, inspection. We do probably about 200 or a little more than 200 a year. Well, we need to do 200 a year, but we only got about 130 done last year.
For 0.3 FTE, that's still.
Yeah, and when we think about that program, we think 2 inspections a year is probably about 4 hours of staff time when you add it all together. So that's a lot of hours. Fees, the statute allows us or allows you as the board to establish fees for that environmental health service. So you review our fees every year and approve those fees. We invoice at the time of our inspections. However, because there's really no teeth in regulations, we have no administrative procedures or anything to really hang our hat on in terms of collection. We struggle to get people to pay the bills. So this is an area we may be approaching the board in the future to really, the State Board of Health adopted the Model Aquatic Health Code by reference. And so we are enabled to create our own local regulations, which could include administrative procedures such as licensing, similar to some of our other programs. So we could hang our fees on a license rather than on an inspection. I think that would be much more effective way of.
How expensive are they?
The pool inspections are, I think we're at, it's $170 an inspection. Yeah.
Jim, can I chime in for a second?
Michael.
One of the things I want to point out when it comes to those swimming pools, I've personally taken a set of invoices out about 4 times now over the past years. So collecting has been a challenge.
That's Michael Clark, one of my environmental health specialists.
And you do plan review for new pools that are being built?
We do.
I've got a question.
Yes, here.
What's the difference between a public and a semi-public swimming pool?
That is best explained by the type of facility. Public pool is one that's open to the general public. Like a rec center or something like that.
Mhm.
Semi-public is like a hotel kind of pool.
What
Where
about like a
it's only open to the customers or private. Private pools are not regulated. So condos, apartment buildings, those are not regulated in Colorado.
Because they're private.
Yes. The model aquatic health code does allow for that, and we could do that, but that would be a heck of a lot more work.
Well, I mean, we're funding then, I don't know. That's a lot of work.
Big combo with kids that are like full of noise and like that, so. That's true.
Other questions on that? We will move on. Lindsay? Environmental compliance, solid and hazardous waste, very small program, but one that seems to be at the forefront quite often in this body. We currently have about 2.2 FTE spread among 2 to 3 staff. This is where our methamphetamine affected property regulations lie. We had 45 cases reported this last year, or cases that we worked on. We happen to be the designated local governing body in Jefferson County. That was a designation made, I believe, by the county commissioners way back in the early 2010s, I think, when the first regulations first came out. Under this program, we also have our waste tire inspection grant. There's about 250 facilities in Jefferson County that are required to follow the state's waste tire regulations. We've been fortunate to get a grant from the state to fulfill those needs over the last many years. Initially, I brought back some of my retired staff to fill that role, which was a really good thing for them. In the last couple of years, we had a woman from Golden who only needed to work part-time or had other obligations, so she did a fantastic job, and so the state gobbled her up, and she's now working in the state waste tire program. We've reduced that grant this year also. We just signed on to the next year's grant, but with the condition that we may not fill that position. Just depends on how we can work things out in our budget for 2026. And then another element of that program is the environmental site assessment requests or environmental records requests. We have years and years and years worth of records in various formats that oftentimes we get requests for from environmental consulting firms and others who need to know or want to know about what may have existed on a piece of property prior to whatever action is taking place now. So Madison does all of those, and 92 of them last year. So fortunately, we've streamlined that program pretty effectively. It doesn't take a lot of time and effort to respond to the consultants. We do occasional assistance on small solid waste issues, hazardous waste issues. We also occasionally get some noise complaints that falls under this program. And then we've had a long-standing relationship with the Rooney Road Recycling Center Authority. We've had staff on the authority's board for many years. Dr. Johnson was actually the designated person to represent the county on that authority board. I now sit on that board, and I participate as the county's alternate in making sure that we're operating effectively and legally as an authority over collection and management of household hazardous wastes in Jefferson County.
Occasional noise complaints will come.
Yeah, I was just gonna ask that question.
I get my neighbor's dog that barks at 8 a.m.
Yeah, I mean, I worked on a project several years ago with Red Rocks, noise issues, Vandermeer noise issues. Yeah, they have, just somebody playing their music loud or a business that may be doing something that is irritating the neighborhood. I mean, most of that's handled through the sheriff's department now, because they do.
Or the police departments.
Yeah, so it's city ordinances.
Yeah.
It depends, but my most recent one I shared with you was pickleball. And I was working with the planning and zoning folks on that one.
For noise or for what?
Noise.
Noise.
The courts were closed at night. but during the day, they were very loud.
Good Lord.
So those are the types of things we might get dragged into. We may do a little research. We may support another department in addressing it. Could become more of a zoning question, could be something else. So I did a bit of research on pickleball, so I know more about the pickleball noise than I ever wanted to.
Yeah. I bet you do.
We don't get any tipping fees for any landfills or recycling centers.
That's an interesting question, because for years we did get some funding out of the tipping, from the Foothills landfill.
Yes.
Yes, do we still get that?
Set amount, it's recoded and buried,
Okay.
so as long as nobody calls attention to it. There was a point at which
Yeah.
it's still an EH revenue line item.
Okay.
However, the county did ask a lot of questions and wanted to have more accountability tracking of that, how that revenue is used, but has since moved on to other problems and not come back.
I think we tried to create a compelling argument to keep that.
Well, because we need funding for things that are growing like methamphetamine. We've got all this work,
Well,
there's no funds.
And that is actually that is what the justification that we created for keeping that funding coming to us is that we are doing all these things related to solid and hazardous waste, so we should get that tipping fee. I think originally when the certificate of designation was designed here in Jeffco for that landfill, the funding was really earmarked for well water testing or the monitoring well testing and covering lab costs and so on. But as time went on, we stopped doing that. The landfill has their own consultants doing that. So we've kind of created our own compelling case to keep that with public health because we do deal with some of these issues.
What about the waste tire inspection stuff? I mean, you get money from them.
That's a grant, a state grant. And then it's really to just inspect to ensure compliance with the state's.
And then they pay, okay.
They pay us, the state pays us for that. And we only designed that grant to cover, we designed it to cover all the hours of the individual we have working. So it's been more of a part-time position for the last several years. All right, next. Housing and institutions. This is where we capture information about our childcare school inspections program, our body art inspection program, along with other housing issues that we often hear from the community about. We have 2.2 staff spread across 16 people working in these various programs. Currently, we have about 360 state licensed childcare facilities, about 40 private charter schools that we inspect regularly according. And then those are inspected on a risk frequency basis. So the higher the risk they represent, the more frequently we will inspect. Schools with laboratories, workshops, and so on get an annual inspection. Elementary schools, those that don't represent much risk, get it once every 3 years. We also inspect our childcare facilities in a similar fashion, in that those that do diaper changing, food preparation will get 2 inspections per year, whereas like a before and after school camp or something like that, we maybe only get 1 inspection.
Does the state give the county money for that?
No.
So it's an unfunded mandate.
In essence, I mean, we do collect fees for childcare inspections, so.
Oh, you do?
Yeah,
From the childcare facilities?
yes. So we try to cover some of our costs.
Okay.
And he gets the very small grant for food.
Care.
Retail food, childcare at school.
It's double what it was 2 years ago.
Yeah, $25,000, but it's probably,
Wow.
maybe covers 1 person.
And then our body art program has grown tremendously. It's like doubled in the last
And
5
they pay
years.
fees.
They pay license fees on an annual basis, so we do collect, I think it's $250 for a license for the body art facility. And that, we do 1 inspection per year, unless we have complaints or other reasons.
You know, I have a question, and you may not be the person I had a person ask me the other day, and I was just very surprised. I'm not a big over-regulator, but it seems odd to me that you can go to a day spa. And while there, you can get a few extra treatments, you know, like Botox or micropeels or whatever that kind of stuff is. But you don't have to have a license for that. You don't have, they're not, I called Dora, they're not licensed. A massage therapist was standing in for the lady after this person got the procedure done. She was asking her questions. She goes, wait a minute. This isn't what you normally do. And she goes, no, I do massages. Isn't that weird?
That may or may not be okay, but.
Yeah. Well, and Dora, I called Dora and they said, no, that's exactly right. How strange is that? But yet they have body piercing or 2 tattoos or whatever, has to have a license.
That's right. But some of them, like the permanent makeup, is regulated by DORA and potentially regulated by Jim. So
But some of these procedures that you have done, that's like, just chemical on somebody's face around their eyes.
I thought there was a professional license for
But
those.
you don't have to have an esthetician license to do those specific ones. I was shocked, and so I called them, I said, no, this can't be. Yeah, that's right.
I have a
Anyway,
question about schools and childcare facilities.
Mhm.
So you regulate the private and charter schools. What about public schools?
We've had kind of a longstanding agreement with Jeffco Public Schools. They have a whole engineering environmental team that works across the district. So we've worked with them over the years to make sure that they are conducting inspections in their facilities in accordance with the state regulations. And just recently, we've been working with them specifically on chemical roundups and chemical inspections, because that's really where the biggest hazards lie in many of these schools. And they're catching up and finding some pretty nasty stuff in those schools. But the contract we have with the state says if we do not have the resources to inspect those facilities, we just have to tell them we can't do it. And so we're able to kind of back out of some of that. But we're fortunate in Jeffco that we have a school district that has invested in ensuring that the facilities are in compliance with state regulations.
so if you just don't have the people to do it, then you're not bound to it. But then with that problem has to come away.
Yeah.
And it's a really tricky program because there's no money associated with it, so the local governments or the state have to absorb the cost of doing those inspections. We've been able to, I think, get around that effectively by inspecting all of our privates and charters as required by by the regulations, but also working closely with the state, with the county school district to make sure that they're abiding by the state regulations.
So many questions about that. Because like some schools have pools, some, like they all have food preparation. Those all fall under their school district.
No, we do inspect the pools, retail food, and the retail food portions of the schools.
Okay.
We're talking about the physical plant
Yeah,
or,
okay.
or those educational areas of the school, like chemistry, biology.
Yeah.
Art labs, workshops, those kinds of things are all under the state school regulations. And those things get done by the district.
Sorry, I got a little confused when you said before if they have food, they get inspected twice, but it's because they get retail food and a facility license inspection. Is that correct?
Now, in fact, that's one point of clarification we should make, is that retail food, we do one inspection per year in the school cafeteria or kitchen facilities. We've been asked to do more than that, but because of USDA requirements, but because of its resource issues and capacity, they don't pay. And they are a no fee license.
Yeah, okay.
So. All right, the last thing on housing and institutions with that, and this is a point I wanted to really emphasize with you all, is that we are getting more and more and more complaints about substandard housing. My staff spend a significant amount of time responding to phone calls and complaints. We don't often have any authority to do anything, so the best we can offer is resources to organizations that might be able to help, especially if there's a need for legal aid to really apply the warranted habitability laws in the state. This is one where I think this is where we could really work in the future to advocate for some change, because there's really no resources. The warranted habitability laws are okay, if you will. I mean, at least they provide a route for someone to address some habitability issues within housing, but they really don't provide an guarantee. And it's really an involved process on the part of the resident to get the landlord to do anything. So I think this is an area for us to be watching in terms of policy change in the future.
Are there landlord tenant organizations that support some of that?
We use Colorado Housing Connects as the kind of the primary, but what we're finding is they're not super effective either in getting people what they need. And I think a lot of people just give up. Live with some of it to support.
What about our local housing codes, like for the municipal? Is that strong enough to address some of this?
I haven't done that research, but I highly doubt it. Other than where there might be a life safety issue, the building divisions of various governments might be able to take some of those things. But if you're talking mold or infestations or those types of issues, there aren't residential codes anywhere. There's beginning to be some effort. I think the city of Edgewater has adopted a rental property registration kind of program where landlords have to register their housing units with the city. And I don't know for sure, but I think they may have some sort of inspection associated with that, so that at least they can have some assurance that the housing is in relative good condition when people move in.
Or at least there's a place for them to go.
They could talk to the city about things like that too. I think there's a lot of interest on the part of other health departments around the region too, to look at opportunities for at least developing these tools for local governments to use to at least have an accounting of the rental units within their jurisdictions.
And can the cities do that now?
I think they can. I know there's a number of them across the country that have done it. And we've been starting to do a little bit of research here at the health department.
Because that would be the best, is if the city had an ordinance.
Of course, we can't force the cities to do much, we can't cause them to adopt an ordinance or whatever, but I do think that a number of them are hearing enough about these housing issues
Oh, there's a lot around local
want to do
control
so.
too.
And then left issues and boarding, all the health components that come into some of those properties. The cities have a lot more authority to put regulations in place than we do.
Yeah.
But it would be good that it's a joint where public health can support.
Yeah.
I know that was something that we dealt with, is these multi-agency issues, with health people involved, housing, code enforcement involved, public health, just because there's a whole host of issues going on with these properties. They're not gonna get fixed, so force a cleanup, but the person has a mental health issue, but it's gonna happen again, so.
Next slide, please. Quickly go through a few more of our programs. We do support our land use, our planning and zoning department here at the county on environmental health land use issues. We have about a half an FTE spread amongst 2 to 3 staff. We review 200 to 300 applications on a referral basis with the planning and zoning department on an annual basis. we cover a lot of different types of applications, anything from subdivisions, rezonings, to special use permits, to special event permits. So there's a lot of work that's done, a variety of potential issues associated with land use. This is fee funded. You all approve our fees every year upon review, or you have been. So, yeah, and I think as we move towards moving into this building, the relationship with land use, planning and zoning and building improves tremendously. I think significant opportunity to interact and improve the way that we function as an overall land use permitting agency, instead of having public health be a referral, strictly a referral agencies. Next, please. Our zoonosis surveillance and response program. We conduct surveillance and investigation of activities on a variety of zoonotic diseases that occur. I think we have just about every zoonotic disease in Colorado that happens here, including rabies, plague, West Nile virus, tularemia, Ypsi fever, other tick-borne and mosquito-borne diseases. We also work very closely in this program with our local animal control agencies in investigating animal bites and other activities around for rabies control primarily. And this program is supported by general. We do not have any kind of fee or mechanism for funding this program. Next, please. Air quality. We have about 1 FTE spread amongst 2 to 3 staff. It's mostly grant funded. For the last many years, we've done minor source inspections, CFC inspections, that's chlorofluorocarbon compounds. We'll get these. Open burning permits and complaints under our contract with the state health department. I have made the decision this year to reduce that contract with all the effort the state has been making to hire air quality specialists. They have hired 190 people in air quality control division, air pollution control division over the last couple of years. We do about 20. We've been doing about 20 minor source inspections a year, so I think they probably handle that. And so we've turned back the minor source inspections and the CFC inspections, and we've retained the connection to the open burning permit program, as well as being a local response agent for complaints, air quality complaints. So typically the complaints we see are dust blowing off of construction sites, or weird smoke coming from a stack somewhere, or an odor from a shop, or whatever. And so we also, by this contract, are obligated to keep our staff trained in the state's required methodologies for detecting odors and opacities. So that helps them if we do have a problem here. Enforce as needed on those kinds of issues in the county.
Does the state provide that?
Do they?
I have just a question.
Does the state provide the training for opacity and smoke school
Yes, so, yes, they reimburse us.
and for odor?
Yes.
Yes.
Smoke schools twice a year.
You guys, are you involved in any of the ambient air monitors for the regional state does all that? Or?
We are not involved with the monitoring program. As you know, we have 3 or 4 ozone monitors here in Jefferson County that are reference monitors for the state. I'll talk a little bit more about my air here in a few minutes. We do love miners on this slide. We have had the Love My Air grant. We're in the middle of year 2 in that grant. That is our PM 2.5 monitoring program that is being funded by an EPA grant. It's year 2 of 3. Had a lot of interest. We've done a lot of outreach. We're working on, now that we have a year and a half worth of data that we've collected, we'll be working on doing some analysis of that data. To try to give a picture to the community of what the monitors are telling us. I'm just kind of refining and moving into a little greater depth into that program. Small particles, 2.5 microns or less. We do respond to general air quality concerns. I mentioned smoke, dust, and so on. And we've also been connected in a number of ways with policy work and outreach work. Madison works with the regional air messaging and management group.
Yeah,
RAM group.
Ram.
They are it's a regional group, many people, like 75, 80 people associated with that group. And it's about getting information out to the community about air pollution, air quality control, various initiatives that are underway to reduce air pollution. So we've begun to slowly engage in those groups. I've also worked pretty extensively, not this year, but last year, the legislature was working heavily on air pollution legislation, and the Air Quality Control Commission at the state was also working on many different new regulations to control, particularly ozone or precursors of ozone. And so Kathy Parker and Kathy from the county attorney's office and I joined local government coalition, worked on a number of regulatory and statutory issues through the coalition. So really, being such a regional issue, I think it's important that we be part of that regional action. And this might bring up opportunities for us to have you engage in some advocacy around some of those issues. Next slide. So getting near the end. We do a lot of work, cross-cutting work in planning, response, recovery to disasters. We have a small EPR team works with our EPR group here at the department, really trying to build capacity and making sure that we're prepared because when something happens to support the EPR efforts of the department, as well as the emergency response, preparedness, response, and recovery efforts of the county. So we're slowly building that capacity. I've got a relatively new staff member who's really focused into the Ether program down in Anniston, Alabama. He's working on some training that's going to help us to be set up to be part of the EOC for the county in the long term. So really wanting to get prepared because we know they're coming. Those things are going to happen. We have longstanding roles working with our EPI team on various things like critical illness response, diagnosis response. It says EPA surge staffing, it's really EPR surge staffing. We're working with EPR to prepare for surge, some additional surge capacity and things like measles and other outbreaks that we might need to participate or we might need additional staff. We are doing a lot of work in trying to improve our business processes across the board, working with our county IT on developing the citizen portal application so that we can do more e-business, get more of our applications, more of our fee payments and so on online so that we don't have to do so much manual administrative support. And I'll tell you what, databases, they can be a pain in the neck. And we have Amanda, I mentioned earlier, we just 2 years ago went through a major update of Amanda. It was a project that lasted 3 years. The implementation has gone on. In the course of implementation, there's been dozens of updates to the database, to the current version of the database. So in the next 3 to 6 months, we're going to be doing a whole series of updates. So it's a constant battle with making sure that the database is updated and functional. I really shout out to Sean Callahan, Indy Raymond, who are our experts in that program. Because it just chews up a lot of time. So, next slide, Lindsay. Few emerging environmental health services initiatives. We are really, as I mentioned earlier, trying to incorporate principles of environmental justice, health equity, climate change, and environmental sustainability into all of our day-to-day work, the mandates and the non-mandates. We want to really try to train up our staff to understand how to apply these principles so that we're not only taking care of the regulatory roles that we have, but also doing more good for the community by addressing these needs and gaps in. So a couple of things we've been involved with, the EPA grant, the Love My Air grant. That grant was based on locating our monitors in disproportionately impacted communities. So that we used GIS and the state's EnviroScreen program to identify appropriate communities to put those monitors in. The RFFM, Certified Food Protection Manager classes. The RFFM is a National Environmental Health Association grant program that's funded by FDA. But we use it, we got a grant to apply it to our Certified Food Protection Manager and really make those classes more accessible to particularly limited English proficiency people, or those who may not be able to afford the higher cost certification programs that are available in the state. So our surge grant, our radon grant that I mentioned earlier, the one that pays for our National Radon Action Month program, that one has been over the most recent years really putting more emphasis on our disproportionately impacted communities, really doing more outreach, really trying to extend the reach of the low-income radon mitigation program into Jefferson County. That's a state-funded radon mitigation program. And then our most recent example of environmental justice, health equity in our work has been involving our mosquito trapping and surveillance.
You can come to my house.
You got mosquitoes?
Yeah.
Well, it's been raining.
It's been raining.
But we did a similar effort as we did with Love My Air to utilize tools that are out there to identify communities that are more underserved and put our traps, identify good locations in those communities to locate our traps. And then do more outreach into those communities as possible to make sure folks know what to do, how to protect themselves from mosquito or illness. Climate change, environmental sustainability, you all know that we played a heavy role in the development of the climate action plan. Several of our staff, as well as Harriet Hall, sat on the steering committee for that. We've worked closely with our EJ program at the department on a mobile home weatherization project that ties directly to the climate action plan, which has a priority of addressing resilience in communities, particularly those that are underserved. So we're really excited for the results of that. And then I've mentioned many times our fleet electrification pilot project. We're now in year 2 of using EVs for most of our inspection work. We haven't gotten the most recent numbers, but as soon as I do, I'll make sure I show. I'm just gonna buzz through a few things. Next slide, please. I'm gonna include, when I do get these slides out to you all, I hope you'll have them handy for a reference if you need them. But this slide is a bunch of links for the various commissions and a few other links for some specific issues like ozone, ethylene oxide. These are issues that are specifically relevant and important to Jefferson County. But I've broken this out by I've included the overall boards and commissions website, the air pollution control division and commission sites, water quality, hazardous materials and waste management, solid waste, and the division of environmental health and sustainability, which we work very closely with for our food, childcare, schools, and many other programs. So I also intend to expand this list a little bit for you all so that you'll have something handy to refer to if you get a question or somebody asks you a question about something involving that topic. Next slide, please. So some things the Board of Health may or will be getting involved with. One of your key roles is rulemaking. You have a responsibility by state statute to adopt local regulations for onsite wastewater treatment systems. That program was delegated by state statute to local governments. The health department has overseen this program forever, probably 50+ years at least. And so our Board of Health has always been the governing board that adopts revisions to the state's regulations. As the state develops regulations, the base standards for the state, locals can be more stringent, which Jefferson County has always been more stringent than the state in some elements of the regs. So it's up to this board then to follow the appropriate public process for hearings and review of the revision proposals and then hearings for adoption. Same with the meth affected properties regulations. This board adopts the administrative regulations for that program as the local governing board. The state adopts the regulations for testing, cleanup, contractor certification requirements, and so on. And then we, under our regulations, then implement the state's cleanup requirements under our administrative procedures. And then swimming pools, we need local regulations. So this is one that will likely be coming to you in the next year or two. And then just a kind of a quick update on the OWTS regulations. The new state regulations adopted are effective now, and they were adopted in March or April this year. So they are effective. So we have 1 year from the effective date to move parts or adopt provisions that are consistent with state changes. So Mitch Brown will be leading that project. Mitch will be coming to you probably in the next several months to kind of go over the process we intend to follow and engage you all in terms of when we need to think about public meetings.
So it'll be this year.
I think we're shooting for the end of the year or early part of next year.
Can I keep Lane as a lifeline?
I know.
Well, I'm
I
still
will not be
here.
on the board when it happens.
No, I said a
We'll
lifeline.
have Mitch.
Well, this is true.
Yes.
Another function of this board is onsite wastewater treatment variances. You all know that we used to do a lot of those. But now we have greatly reduced, thankfully, due to your policy decisions that you've made. We've been able to reduce the number of variance requests. And I guess thanks to the attorney's office for recognizing that some of the lots that were asking for variances really didn't need variances because they were created before regulations had a minimum lot size. So I've included on this slide the links to those two policies in case you ever want to review those. We are doing our best to also, as we do revisions to the regulations, to incorporate many of the board policies into the regulations so that we can then get rid of the board policies. Yeah, this rulemaking is a great opportunity. Yeah, I think you're right. Enforcement, you all know that you can be part of the enforcement process. I think we've had enough interactions recently with our attorney's office to know that we will have those occasions when we don't need to enforce rules or laws. And so at some point, you may also need to issue public health orders that are related to environmental health issues. So you have that authority. You also have great authority when it comes to public health nuisances, which is what we did recently with one method. The last item on this slide is about advocacy. And I don't know where I want to go with this, but I do know that this is a role that I think this board has a tremendous opportunity to help us on a number of different fronts. And if you go to the next slide. Things to be thinking about or listening for in the community. One that was already mentioned tonight was the food freedom movement in this country. Last year, we had a bill to expand the cottage foods laws in this state. And fortunately, that did not pass, but it will likely come back. And when we talk
all the time.
it will likely be done. Because of what I heard, the tenor of the committee meeting was much greater support for small business and entrepreneurship. So balancing those things with food safety and public health is going to be delicate balance.
Right.
And so and I've been doing some research. CalFel is actually pulling together a working group around this particular issue. That'll be working over the summer to do some research and maybe working with advocates and the other side on potential legislation. So just things to be aware of. Raw milk is another one that comes back constantly. With the change in administration, we may see other changes there or difference of opinion or approach. Another one that may come back this year is the on-site wastewater treatment system low-income financial assistance bill. We all know, I think we all understand the need, but we don't have a lot of information, data, and support, other support that would prove that need. So I think we're going to be, there's work underway. I'm kind of working with Elisa Witt from Gilpin County to oversee some research at the School of Public Health to help us identify maybe methods of determining the actual need for that type of program, identifying potential sources of funding that would be adequate to support a statewide program, and then effective implementation mechanisms. Last year, you may recall, it was an enterprise fund that was proposed, and that really didn't fly. And so there's got to be a lot more, I think, communication on this issue, and I think advocacy to legislators, towards legislators to get people on board with it and try to find ways of getting if we're going to make it a statewide program, getting the legislature. You're going to hear about air quality issues from now until eternity, I think, in Denver. Ozone is going to be around. It's not getting better. It's going to be, if it gets a lot worse, we're going to be awful. So there might be a real need for all of us to be pushing hard on methods to control the precursors, limit the amount of ozone. Environmental justice, sustainability, resiliency, and many, many other statutory and regulatory issues come up throughout the years around environmental health issues. Last slide, please. So let's have a conversation. A bit normal. If you have anything else you'd like me to clarify or anything.
I just have a question. It seems that it's really hard to say that it's just Colorado that are out of compliance with, the air quality stuff.
Mm-hmm.
But how do you stop the fires that keep drifting into our state? That certainly adds to it.
Mm-hmm.
We have no control over that. How do you penalize a state that can't control those outside things? I mean, that Canada stuff was awful.
Mm-hmm.
What do you do?
in my opinion, that's a bigger issue than what we're gonna be able to deal with at a local government level. That's gonna take federal policy, it's gonna take, industry policy, it's gonna take land management policy. There's all kinds of things tied to how fire happens in the first place and the impacts that it has on the environment.
But the state's being held responsible for it.
I think there's provisions in the rules and laws that allow for exceptional events to be taken out of the picture. So,
Last ozone, though, that's not the driver. It's our cars, it's our industry.
Is it all the people sitting in line
Oil,
for the
gas,
fast
industry.
food restaurants and Starbucks and all the coffee shops
Every
that are
time
just
you're
idling?
filling up your gas, every time your car is running, yeah, that's part of it.
it's interesting you say that because I sat in a regional air quality council meeting just a few months ago and asked the same question.
I know, because you and I talked about it, that's where I got it.
And there wasn't a response. I mean, you know, the state does a lot of research and modeling and so on to try to determine what would be the most effective source reductions for ozone precursors. You know, we can stop selling gas-fired lawn equipment. We can put controls on cars. We can put, you know, new RTD programs into place. There's so many things that can be done, but to get someone to get out of their car or to get somebody not to drive by themselves to work, to get, you know, I'm as guilty as anyone on some of these things. Not mowing my lawn at 3 o'clock in the afternoon on an ozone action day. These are things that, unless we get more effective at conveying the message in terms of really demonstrating, this is my opinion, demonstrating the impact that this is having on public health, we can say all we could want to say about how to reduce the sources of the emissions. But until we prove that, you know, our death rates are going up, or our cancer rates, or cardiopulmonary diseases attributed directly to ozone, we're not gonna get people out of their cars.
Well, and we've demonstrated direct attribution in other health
Cheap and
risks like
subsidized.
smoking, and it's not preventing people from.
Guaranteed it's cheap and subsidized, so it's there's not a cost prohibition for you to drive.
I mean, there's glimmers of hope.
Yeah.
You know, we have a lot more EVs on the road than we ever had. We're having a lot of solar power generation being.
There's reduction in some of the Excel plants, there's less coal-fired plants. than we've had.
I have a gym question.
Oh, good.
Let's
like
not get personal now.
So, no, like a question for you as a director of environmental health. You split your FTE over a multitude of programs. How do you predict and or handle spikes and or high demand times when you have staff who are spread over a multitude of things? Like, how do you know and predict and understand your staffing demands, given how spread out they are across the program?
Challenging question.
No, that's why it's a good
It
question.
is a challenging question. Can I get back to you on that?
I mean,
I don't know that there's anything I could say specific to answer your question.
Yeah.
We know what we have to get done by our contracts or what we're supposed to get. I mentioned that our contracts are mostly written in ways that allow us to say, we don't have enough resources to do this, so we're gonna only do this much. COVID's another example of where, you know, we stopped doing restaurants for a while. Inspections weren't being done because nothing was open. But then we had a new one of enforcing public health orders.
yeah,
You know, when my management team meets twice a year to reallocate workloads. So we look at the number of hours we have available for the existing staff or the existing positions, including vacancies. And we have good sense of how much time is being spent doing certain types of work. So we're able to take those general numbers and apply them across the board to those who have the adequate training, that that can fit and we try our best to distribute the workload. We also want to be efficient in how we distribute work. We prefer not to have someone inspecting a restaurant in Westminster and a pool in Little, South Little, so we try to divvy up the workload in a way that all of that work that's in an assigned area is being done by the same, to the greatest extent. It's not perfect by any means. And as I mentioned, with all of the turnover that we've had, it's been tremendously difficult to cover it all because there's generally a 2 to 6 month training period for new environmental health specialists. Even though we may have some that are coming in that have 4 to 6 years of inspection experience, they may be coming from Illinois, or Washington, or somewhere where they have to learn our system. Some of them have exactly what we need, and they might get cleared within a couple of weeks. Wish they were all like that, but
That's not what it is.
yeah, we have to learn a new database. Yeah. So there isn't a really clean answer to that question.
I didn't expect there to be that.
We tried our best to really prepare, and understand what the program demands are. So, and then we really try to work with the staff we have to make sure that we're creating adequate depth in those programs to be able to cover the demands. And then, of course, there's always the one-offs that, we get an outbreak or something, or we have a puppy mill rabies situation or whatever, and those things chew up time. And we're gonna respond to those because they're priorities. And then we'll get back to the work that we typically do.
I think it's really important that we not do all of it with whatever staff we have. There is absolutely coverage. It's like we can't get to all of these because we don't have the people. It's very limited. That is a burnout. That is a turnover generator. We should not be doing that.
I'll tell you, when I first came to Jeffco, we've had years where the turnover was so bad, I just said to the management team, our target this year is to get 80% of the work. Our target is 75%. We're gonna prioritize based on risk, and we're gonna get the highest risk facilities inspected. But the low risk stuff's going off the table. And that's really the only way I could think to address public health, the public health risks that we see relative to the types of facilities we regulate being adequate. Just as there's not enough money, there's not enough people, they're never ready to do everything we would want to do, let alone the thing. So we do the best to abide by whatever methods we're bound to from the state or others, and really work constantly to try to improve our programs and our methods so that we're the most efficient we could be in order to gain the highest effectiveness.
Well, I just want to thank you for putting all the time in that it took to do this, because it took a long time to put together this whole presentation. It's very, very helpful and very informative. So there were all of your duties.
There's a lot more we didn't cover, but I thank you. And I also want to give a shout out to Katie Kavanaugh Smith, who put that beautiful Canva PowerPoint together for me.
Oh, yeah.
I was gonna say, did you use Canva? I was like, what? Oh, okay, maybe not. I mean, good for you for going through it.
I had to actually put a regular PowerPoint on the old branded template, but I was told that that's no longer the template that we use. So I panicked and then I called Katie.
You did a beautiful job.
Yes, she did. And also my staff pulled a lot of the data together for me for you to see today. So
You have a great staff.
indeed.
We appreciate them.
And anything else I can share with you?
Anybody online? Harriet, Rochelle?
Great job, Jim. I love that. Very informative. I loved it. I learned a lot. Thank you.
Yes, thanks a lot. It was very well put together and lots of good information and Thanks for putting it in a format that we can check back to it later, should we need to.
I will have the presentation and probably a few other pieces of information, in a little packet, and have Nancy send that
That's
out
great.
to you in the next couple of weeks.
Thank you.
All right. Thank you very much.
Anything else? Let everybody go.
This really was great. Like, I know everybody's already said it, but man, this is awesome. Thank you.
All right, we will adjourn.